Data from the Nigeria Center for Disease Control about the spread of monkeypox are not cheering. While Nigeria and indeed the rest of the world is celebrating a lull in the spread of COVID-19 and coming up with plans to reverse its impact, a resurgence of monkeypox silently crept in on us, with figures from September 2017 standing at 869 suspected cases as of July 24, 2022 in 35 states. 3 confirmed cases have already led to 3 deaths from 3 states. Apart from aiding and complementing surveillance at the national and subnational levels by the Disease Control Center, public awareness is quite crucial at this point to drive prevention and other non-pharmaceutical management. So, on Panorama today, our focus will be on how members of the public can take ownership of the efforts to fight the scourge. Do not forget that you can follow this news broadcast live on our website at nta.ng/live and on our YouTube at NTA News Online. You can also visit our Facebook page at NTA Network News, Twitter handle at NTA News Now, and on Instagram at NTA Network for updates. I am Hinginu John Adams. Welcome to Panorama. We begin with the Minister of State Petroleum Resources, Timothy Silva, on the sideline of a stakeholders' engagement in Abuja by the Nigerian Midstream and Downstream Petroleum Regulatory Authority, told journalists that the federal government has not removed subsidy on petrol. He says any increase in pump price is not from government.
We have not deregulated. The government is subsidizing. If there are increases in price, it is not from the government. It's probably from the marketers.
OPEC Secretary General Haitham Al-Ghais of Kuwait has assumed office with the commitment to continue in the strive towards the stability of the global oil market, following the legacies of his predecessor, the late Mohammed Sanusi Barkindo. As part of his first assignment, OPEC Secretary General spoke with Nigerian journalists via a virtual meeting through which he paid glowing tributes to the late Mohammed Sanusi Barkindo. Media Samson reports that shortly on assumption of office, Al-Ghais interacted with some Nigerian journalists during a virtual media briefing. He commended his predecessor for his effort towards achieving balance and stability in the global oil market. He says, as Secretary General of OPEC, late Barkindo championed the producer-consumer dialogue aimed at establishing a consensus on some of the major issues of concern to all parties, such as market stability, security of demand and supply, investment and sustainable development. While condoling with Nigeria and Barkindo's passing, Al-Ghais said the former OPEC scribe's death is a big loss not only to Nigeria and the oil industry in Africa, but also to the entire world. He expressed the hope that he would be able to build on the many legacies and policies Barkindo built and left behind. Al-Ghais acknowledged Nigeria's stature as a key member of OPEC, representing Africa since 1970. He commended the initiative to undertake the construction of a regional gas pipeline that would convey Nigeria's gas to Algeria. He described the project as a significant development aimed at positioning Africa to take advantage of the opportunities in the world's energy market. Now talking election matters, INEC has officially released 12,298,000 58,944 as the number of voters registered before the suspension of the exercise on the 31st of July 2022. This was contained in a weekly post of INEC on Monday, 1st August. Adding this number to the existing voter strength of 84,004,084 before the 2019 elections brings the total number of voters in the 2023 elections to 96,303,028. Reports coming from the ECOWAS Situation Room indicate that more civil education is needed and that more physically challenged persons should be carried along in the electoral process. These were some of the issues raised as ECOWAS mission observers presented their reports. Hamman Jabani reports.
The fortnight ECOWAS mission observers were able to cover a total of 2,937 polling stations during the legislative elections. Briefing the head of the mission, heads of the various teams commended the commission for giving them the opportunity. And while carrying out the assignments, they observed that there were large turnout of elderly and women, but that could not be said of the youth. Several physically challenged persons could not access their unit due to disruptors of the polling stations. They observed the high presence of security personnel. All electoral processes were carried out professionally and no irregularity were witnessed.
On our own case, because we stayed in this situation room after we came, we also had that there are some localities like Bambi that due to the rain, that they were unable to, they had to extend the time of the voting. There's also the temporary cessation of voting in one or two areas as well, which they mentioned to us.
Head of the mission, ECOWAS ambassadors and parliament speak on the observations.
Everything went perfectly well, and it is also the views of the members of our situation room who reported to us that all over the territory of Senegal, it is the same observation. So as head of mission, I am satisfied of the work of my team, and also we are satisfied on the way this election were carried out.
When we talk about strengthening democracy, the government has maintained that Nigeria's tradition on trying to assist those countries, both technical and even economic support whenever election is coming up in any of these countries.
7:30, 80% of those people who are standing outside waiting were the older generation, and I must also commend the ladies, our mothers, and for exercising the civic education.
So the Parliament will make that recommendation that we must have a set budget aside to be proactive in our operations.
ECOWAS preliminary report is expected soon. From Dakar, Hamman Jabani, NTA News.
On to the issue of the day. Just when the country began to heave a sigh of relief from the coronavirus pandemic, monkeypox sneaked in and put key players in the health sector on their heels again to tame the spread. This report gives us an assessment of the level of understanding of the ailment among Lagos residents and what relevant authorities are doing to tame the spread. Since the first case of monkeypox in Nigeria in September 2017, the country has recorded other cases intermittently. After the last case and experience in 2019 and 2020, no death was recorded from the viral infection again until this year 2022, when it was reported that the disease claimed the life of a 40-year-old man who had underlying health issues. The strategic position of Lagos State in terms of population and various international borders places it at high risk. Enlightenment among Lagos residents is important and raises a crucial question. How much do they know about monkeypox?
It's contagious, and I also know that it has the symptoms like malaria. I don't have much idea about what monkeypox is.
It spreads fast. I don't know whether it's similar to chicken pox.
I think it's a disease that's spread like a symptoms. That's what I know.
With this, concerns are being raised by medical experts on the need to adequately equip the populace with knowledge on preventive measures.
Patient can present with fever, present with cough, but most importantly is the rash.
If that rashes and inflammation, you see the skin is not properly managed, it can get secondarily infected.
Relevant authorities are putting measures in place to contain the spread.
We produce a CITREP every week, and that CITREP is published open access on our website. We do know that there's an association between increased severity of monkeypox and the increased risk of death in people who have immunosuppressive conditions.
Although the World Health Organization, WHO, believes that the monkeypox situation is unlikely to escalate into a full-blown pandemic, experts are urging Nigerians to promptly report symptoms to prevent escalation of the disease.
Now, joining me for more discussion on how to tame the spread of monkeypox, leveraging public awareness, is Professor Rosemary Audu, the Director, Research and Head, Microbiology Department at the Nigerian Institute of Medical Research, NIMA. Thanks for coming on Panorama. My pleasure. Thank you. All right, let's begin on this note. Can you educate us on the virus and its symptoms?
Thank you very much. So, monkeypox is an illness that is caused by the monkeypox virus, and it's zoonotic in nature, meaning that man can acquire it from animals, and also it can be transmitted from person to person. And this virus is like for it to be transmitted, there has to be a close contact. There has to be close contact. It could be face to face, it could be skin to skin, it could be mouth to mouth or mouth to skin. And even sexual transmission has been reported in the developed world, where this virus has also spread to. So the virus is not as contagious as smallpox, even though they're in the same family, but it's not as contagious. Most people that have the infection present with mild illness, but there are a few people that it could become severe and develop complications that could even result to death, and these include children, pregnant women, and people with immunodeficiency. They are at major risk. Everybody is at risk of the infection. Anybody could be infected. So I guess there's this stigmatization that is going out there that is discouraging people from owning up, but I think we shouldn't stigmatize anybody, because it could be just anybody, and the way it will be, one can get infected if there has to be this close contact. And also, even from animals, those who are at risk, for instance, we know those who are close association with people who are infected, close contact can get infected if they don't protect themselves. And then we also know that even those who handle animals that are sick or dead they are also at risk also, so they need to protect themselves. And even in our own environment, we also need to, because we eat a lot of animals, we have to boil it very well to ensure that there's no trace of it. So this virus is the increase. The virus has spread into 50 countries right now.
Okay, talking about the spread, now in Nigeria we have 35 states that have reported cases. So what is responsible for this widespread?
Well, I think the virus is a virus that we are still trying to understand more. Some genetic analysis are still going out to know what is responsible for this spread. For instance, we know from the spread in the developed world now, where we find that most of the cases have been in West Africa and Central Africa before now. And in 2017, we now start having more recurrent cases. But now they have reported cases in the developed world where it wasn't reported before now. And they are now finding it majorly amongst men who have sex with men. So it's taking a different shape, it's different pattern now. So there's a lot that is still going on. We do not know. We do not know how it has the nucleic acid, the DNA has been found in semen, but we do not know if that is what transmits it. But we know that the symptoms, for instance, of this virus, they have fever. Those who are infected come down with fever. They come down also with headache, and then this rash. They have swollen lymph nodes, and they have loss of energy, and then the rash now comes out later, maybe from the head, from the face, and then to the extremes, the palms, and then the sole of the feet. But the thing is, mother to child also could occur. The child can be infected from a mother that is positive. It is not also clear how this infection takes place in these babies.
All right, Prof, let me stop you temporarily. I said temporarily because we have some messages to pay. The discussion will continue after the break.
It's legal to stand with NTA and stand against rape and rapists.
Save me, save my children. I stand with NTA. I stand against rape and rapists.
I stand with NTA. I'm a star.
I stand with NTA. I'm a star.
Inshallah, I stand with NTA. I stand against rape and rapists.
I stand with NTA. I stand against rape and rapists.
I stand with NTA. I stand against rape and rapists.
I stand with NTA. I am a star.
I stand with NTA. I stand against rape and rapists.
I align my patriotism with NTA in the fight and crusade against rape and rapists.
NIFA, I stand with NTA. I stand against rape and rapists.
Join millions of Nigerians, stand with NTA, stand against rape and rapists. That victim is one of us. Speak up and speak out. Be a star. This message is from the Nigerian Television Authority.
Thanks for being there. I've been discussing with Professor Rosemary Audu, the Director Research and Head Microbiology Department at the Nigerian Institute of Medical Research. So, Prof, moving on, COVID-19 came and we saw a significant improvement in the area of vaccine production in Naima. So, where are we now talking about monkeypox?
Okay, in the Nigerian Institute of Medical Research, we are also doing some work there. We have produced some PCR assays, which we have also contacted NCDC, and working together, they've asked us to bring the assay so that we can validate the assay. We'll need to test some clinical samples, just to be sure that the performance of our assay, that it's good enough. Because currently in the country, most tests are done at the reference lab in Abuja. So if there are suspected cases, the samples are collected and all sent to Abuja. And we know that that is not adequate for this nation. So we need to do more testing, and I guess if we have the ease of testing, maybe people will get to know what their status is and know how to protect themselves better. And talking about the spread of this virus in Nigeria, like I was mentioning to you, it's the virus is beginning to display in unusual patterns that we need to study more about it. And because previously it was mainly detected in West Africa and Central Africa, not much had been done. But now that we have cases in the European world and the Americas, in 50 countries globally, they have reported this. I think there's much more now that is going on. It's like it's an enemy that you cannot easily detect. It will be difficult for you to be able to wage war against it. So we need to improve on diagnosis, which is what NIMA has come on board and we are working on right now.
Prof, briefly, we know that Lagos is densely populated. What should government do to keep monkeypox at bay?
All right. Fortunately, monkeypox can be transmitted by direct contact, with the lesions, direct contact with individuals who are infected. So people need to know what their risk is so that they'll know how to protect themselves. And everybody, to start with, is at risk. It could just be anybody. But if we know that somebody is ill with this rash, then we can, such a person should isolate himself. Of course, report first to the health facility, your clinic, and so that they will be able to tell, because this rash also could present like herpes or syphilis, as it was reported in the developed world, because most of them were picked up from the sexual clinics. But it also, for the children, it could also present like chicken pox, so it's just not every rash. It's better to visit your clinic and then they'll be able to tell what it is. And if you know there's somebody that has it, you just separate the person, isolates himself and take it. But we also need to support such people so that we encourage people coming out themselves, for testing.
All right. Thank you very, very much for that information. Thank you, Professor. That was Professor Rosemary Audu. Moving on now, let's now join the sports desk for details from the sports world.
The West African Football Union has confirmed the new date for the zonal qualifiers for the 2022 CAF Women's Champions League. The zonal qualifiers will take place from August 20 to September 2, 2022. This tournament, which is second in the series, is scheduled to hold in Abidjan, Côte d'Ivoire. 7 clubs will participate in the competition, including Nigeria's NWFL champions, Bayelsa Queens, who are in Group B. In Taekwondo, ahead of the Kukiwan certification coming up in October in Nigeria, the Nigerian Taekwondo Federation has organized a 5-day national Pumse Seminar Kukiwan Dana test, which ended at the National Stadium, Lagos. For the Federation, the event, which had Kukiwan Grandmaster from Korea as the chief examiner, became necessary to upgrade its coaches and athletes in line with the International Olympic Committee rankings.
Once you're not Kukiwan licensed instructor, you are not recognized, you are fake. So what we are trying to do is to build the capacity of our own instructors locally in here to international standards.
In squash, over 50 players from various parts of the country featured at the Frigate National Squash Open Tournament, which ended at the Korea Club, Lagos. The 5-day tournament, which was in 2 categories, under 16 and the seniors, was put together by the Nigerian Squash Federation. It was aimed at developing talents from the grassroots in the sport, as well as rack the senior players ahead of major international tournaments. In boxing, the 120th edition of the Lagos Boxing Show was held at the Molade Okoya Thomas Indoor Sports Hall of the Teslim Balogun Stadium, Lagos. The organizers have been consistent with the fielding of juniors and female boxers at the championship. A total of 10 bouts featured in various weight categories. The Lagos Boxing Show, which comes up every month, is one of the nation's resource centers for the discovery and grooming of talent in boxing. With Sports Update, Gift George, NTA News.
That's it on Panorama today. Before we go, do not forget that the fastest and easiest way to becoming a star is to connect with the NTA to stand against rape and rapists. I am Hinginu John Adams. Enjoy the rest of your day.
Being a woman has been described